大家好今天是1月7号星期四下午3点钟，欢迎大家回来继续收看我们的现场直播 BC 省的新冠疫情最新新闻简报。今天是1月7号星期四。那昨天的数字呢是600多，记得前几天偶尔到过500多1月4号是3个周期4个周期565、607、539，但昨天呢是600多，前天是书面的，记得是400多，但有一点应该说稍微值得欣慰一点，就是新增死亡人数下降到个位数了。会不会是疫苗起的作用就不得而知，那我们也就是 cross our fingers 向上帝祷告，这个不知道是疫苗起的作用还是怎么样，因为疫苗呢它没有这么快取到效果，但第一批打的老人院打的是12月的下旬，12月20几号，那么至今呢也超过2个礼拜，按照他们的理论呢是1个礼拜以后开始产生那个抗疫的作用，不管这个疫苗1针还是2针，他们的这个起效的时间以及百分比，但有一点是肯定的，也就是说打了这个疫苗之后，对人体对这个重症的防护是100%。那么没有重症呢，可能死亡率也就显著的减少，所以这个可能寄希望是这样，没有科学根据的猜测，就是新增的死亡人数昨天是8个，那么新增的数字呢，我觉得不会太乐观，因为已经是过了圣诞节了，那么圣诞节呢之后呢又是元旦。那么这样的话可能会造成的人员聚集。那么中国大陆呢，现在这个湖北情况也比较紧急，他们说是从欧洲过来，有人说是外交部王毅说可能是从俄罗斯过来，那这个就不知道了，反正现在是传了很多了，据说是从这个新闻报道说是从12月份就开始了。那现在呢，我们就等2位官员的到场。照理呢，他们应该说是还是比较准时的，那么偶尔会迟到几分钟。现在已经到了下午3点06分，2位官员还没出场，请大家再稍微耐心等候一下。 好，音乐停了，应该来了。先出现的是 BC 省卫生厅厅长 Andrew Dix， 后面是我们的 BC 省的首席医官叫 Bonnie Henry， 都把口罩给摘下来了。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, January the 7th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. There will be a written briefing tomorrow at approximately 3 o'clock, providing information about case counts and other relevant information about COVID-19 in British Columbia. And with that, and then on Monday we'll be back here in Kelsey to provide a briefing on COVID-19. It's my honor to introduce Dr. Bonnie Henry.
新闻简报是给大家做简报。好，开始了。
Thank you and good afternoon. Today we are reporting 761 new cases of COVID-19 diagnosed in British Columbia. Bringing our total number of people with COVID-19 to 56,015. Of the new cases, 94 people are in the Vancouver Coastal Health Region, 484 people reside in the Fraser Health Region, 23 people are on the Vancouver Island Health Region, 96 people in Interior Health, and 64 people in the Northern Health Region. We now have 6,349 active cases in all areas of British Columbia. 372 people are in hospitals, 74 of whom are in critical care or ICU. In addition, there are 8,849 people, plus some additional from Northern Health who are under public health monitoring. And 47,374 people are now considered recovered. Sadly, we've had an additional 8 new deaths from COVID-19 in the past 24 hours. All of them are seniors and elders in long-term care in Fraser Health, in Vancouver Coastal, and in Interior Health. That brings the total number of people in British Columbia who've died from COVID-19 to 970. And our condolences
好，970个了。那么这样，昨天到今天呢是761个，那么现在住院的是372个，重症监护是74个，不少啊。这个是完全在我的意料之内。那么它也是对这个失去亲人的又有一个新的爆发，也是长期护理院，也是在这个岛上的。
51 active outbreaks in long-term care and assisted living, and 10 in acute care. That involves 2,333 people, 1,501 residents, and 752 staff with active cases right now.
和700多个职员还在疫情当中，也就是 active case.
Since the start of our immunization program,
那么现在疫苗已经开始了。
as of yesterday, have provided vaccine to 41,064 people in every health region across British Columbia. As we know, the burden of COVID-19 has been particularly heavy.
那么他还说了昨天为止已经有41064个人接种了。
And that is where our focus has been and will continue to be.
那么我们目前主要还是对老年人，长期护理院的老年人，所以这个接下来的1-2个礼拜还是这个政策，是重点向他们倾斜，向他们是打目标，是主要是他们是优先，因为我们的供货比较有限，我们慢慢会扩大施打的人群。只要到货源充足了之后。
Protect as many people as possible.
希望这个那个疫苗呢，能够希望尽快的来，能够越快越好。这样的话呢，会保护更多的人。
I also wanted to give an update on the UK variant that we reported on our first detection of somebody who had traveled from the UK into British Columbia with that variant. That person has remained in isolation.
那么现在他还在
However, we have
隔离
now two additional cases.
又有2个了
household contacts of the first case.
因为主要还是
There
跟
are
他
no
们
other contacts, and we do not believe that anybody else has.
他们不认为还有其他有风险，因为这2个人也是他们家庭里边的。那么现在是3个大家注意，就是英国的变异病毒在 BC 目前只发觉3个一个呢在隔离当中差不多应该好了，另外2个也是他们家庭里边的。他说其他人还没发觉接触过。那么我们现在在目前的接触这个病毒在我们省的状况都在紧密的监视中。
There was a couple of things that happened. There will be from the first time we've had COVID-19 cases almost a year ago.
那么1年之前，差不多1年之前，我们有第1例，到现在差不多1年了。那么我们已经每次都把重要的信息都给大家分享了，也是让大家知道我们现在的到哪个地步、哪个程度。那么这样说，我们也是每个人知道自己所处的环境和形势，以及我们所需要采取的措施。
Been trying to automate at least some areas of the collection and reporting of our daily case numbers. As a result, there will be some changes to how the data will be reported going forward.
那么有些地方呢，最近几个礼拜呢，收集的数据的方式有所变。那么这个大家都会对我们提出一些意见，因为这个情况比较复杂，包括的这个人力的安排，那个又是节假期，那么大家又是开始又有一些新的这个界面，这个系统里边的变化，所以呢，他是说到了北部卫生局的。
System is going to be based on automatically reporting lab-confirmed cases from the previous day, plus reconciling with the health authority cases, particularly epidemiologically linked cases, to provide more timely reporting data. So as you know, the BC CDC dashboard and data tables are our source of truth, and they are where all the corrected information will go. And they will now start being reporting by our lab result date. So this is a bit technical, but for those people who are following this closely, most of our EpiCurve on the dashboard has been by what we call reported date. So that's the date that the health authority receives that report and starts the investigation on that individual case. They then pass that information back to the BC CDC to provide the provincial level update and consolidation of numbers. So we're now doing it, taking away one piece of that and having the lab report both to the health authority and to BC CDC directly, so that we can have a timely reporting of the lab cases. There will be an adjustment in tables to reflect the fact that the lab results may be slightly more, it may come on a different day than what the reported result is. Usually it's within a day or two. So there'll be slight changes, and we're gone back and moved all of the cases from January 2020 up until today onto this new lab reported date. So for those who have been looking at the EpiCurves and our 7-day rolling average on an ongoing basis, it will look slightly different, where some of the numbers are moving backwards or forwards by a day or two. There also is a slight increase that we've seen in case counts today, and for a few days as the new system kicks in and the previous lag that we used to have from positive results to reported case is eliminated. So as we know, every day the numbers are from a time, a cutoff. They're a snapshot in time, and they get updated and verified and corrected as more information comes in. And as so, there will continue to be fluctuations in our numbers as cases are verified. So for example, if a case is reported in Interior Health today, and then we find out it actually is a person who comes from another province, that case would be removed. That's why
今天汇报了，他说是阳性的，但是过了几天发觉这个人呢，其实是在外地过来的，内陆过其他地方过来的，所以这个可能就不一样。所以这个数据呢，都有时候的时间的前后会不一样，但是呢，整个趋势啊，整个我们流行病学的都不一样。那么每一个病例，每一个阳性的都会反映出来，每一个人受到牵连的，或者是暴露过的，或有联系的，都会被及时通知到。所以我们都会持续的对面对这个关注一两例的零星案例，也会关注这些爆发的案例，我们会持续的，这个都不会变。那么我们对大家也要汇报这个 PPE 的这个医疗物资储备获得，以及这个测试，以及这个跟踪接触的雇用等等，这个都会不变，都会给大家。那么还有呢，就是根据流行病学，我们收集到的信息，根据流行病学做一些这个 breakdown， 就是分析什么都不会变那么他也问卫生厅长今天说的，你还会说吗？就是因为每个礼拜四会说给大家汇报这个择期开刀的恢复情况，以及这个 PPE 的情况。
are wondering what is going to happen, and like every part of Canada and countries around the world, the risk of spread of COVID-19 remains very high right now.
那么他也是说到了，现在从全球来看，现在风险很高。我们都看到了社区里边都有零星案例以及爆发都在我们省或者是加拿大或者是全球。我们在 BC 省呢也是在公卫系统紧密的关注这个疫情。
As we always have been. In the last days, we have seen a slight increase in our cases, and our curve is trending upward.
又看到了这个曲线往上升了。
Now is our time
所以现在我们还是要
we know
我们不要再这个再上去了我们一定要拉下去。我们过去成功拉平曲线过，拉下了曲线过，所以我们现在还是要继续大家继续做下去，重复做。那么这样的话呢，我们的这个我们的卫生命令对这个还是要到2月5号今天是1月7号，所以到2021年2月5号，所有的禁令持续有效到2025年、2021年的2月5号也就是说，大家关心的今天到期了会不会放松？不会放松，还是和之前一样警惕。就是大家无论都是这个私人聚会或者是还不允许。那么体育也是，那么我们还会紧密的观察这个密切监视。如果我们看到了曲线有往好的方向去，那么我们会慢慢放松这些措施。但是现在我们是要紧握缰绳这个放松不能放松警惕。我们一定要知道有2个星期、2个延长期2个时期。
Especially now
一定要清楚
that we have vaccine.
我们一定要清楚，我们现在已经有疫苗了。
Period of greatest risk and greatest potential benefit.
我们已经要期望的这个现在是最高风险的时候，当然我们马上就会有疫苗的获得带来的获益效益。那么我们的基础工作人员，我们的学校还继续开放，这个是对每个人讲是很重要的不论是心和生理上的、心理上的都重要的，我们每个人都知道。所以我们为了保证这些，我们必须要保护自己，要保护别人这些必须要保护我们的家庭成员，保护我们的所有的社区的重要的人员。我知道 BC 省绝大部分人都是自觉遵守都很自觉都很自律，这个都遵守我们的这个节假日的禁令。但我们也看到了一些新的案例发生，就是因为他们没有遵守我们的 禁令，所以这个这些决定都是他们自己做的，结果他们的行为导致了现在严重的后果这个是要大家我们已经看到了，大家都理解到了那么每一个100个人里边只有1、2个就不违反不遵守这个禁令，那么这样的话就会把我们社区把我们的整个镇城市置于危险当中我们不要管哎呀我们已经厌倦了这个我们烦死了你这个禁令什么烦死了，我们不要有这种想法，我们必须现在就是要积极行动起来，一定要坚持怎么不要去管了我们这个我们的外婆什么时候生日这个不要这个主要是关心的是这个病毒的传播，这个不要再去考虑哎呀外婆的生日我必须去见她了谢谢你们，谢谢大家的理解。那么就算是人员少的这种派对也会有风险那么大家都看到了朋友之间的联系那么过去的几年过去的时间大家都看到了，就是因为这个人群的聚集导致了病毒的传播导致了这个大家都看到了英国安大略省以及美国都看到了生活受到了严重的影响那么但是我们 BC 省没有独善其中没有独善其身，我们现在的风险最高的时候我们不要放松我们的警惕，就算疫苗来了现在是我们是冬天的时候最容易传播病毒的时候那么春天马上就要来了大家再忍一忍那么现在大家呢也要虽然隔离大家也要相互支持，用一种虚拟的方式新的方式来相互支持相互连接那么现在是正好时候，这个时候我们一定要自我保证保护我们的老人保护我们的孩子这个是我们自己做的，我们所做的任何的决定任何的行为导致了任何的结果我们在 BC 省一定有我们的热心用我们的热情去做这些事情，我们也要相互支持相互帮助帮助我们的邻居帮助我们的路人这个都是在相互帮着忙相互支持，我们一定携手这个共同度过这个难关所以我们一定要行动起来来结束这个我们不好的地方，保护我们自己保护社区，如果我们不去行动那么这样的话马上就会更加糟糕那么大家知道我们光明的未来马上就要来了，因为疫苗来了那么天气呢也会越来越暖和了，那么病毒会不活跃，所以希望大家从现在开始每个人不一样表现出来每个人采取行动来相互支持
Do something kind for somebody.
那么如果我们对外的话我们也要对大家相互容让相互客气那是我们也知道很多社区内的我们的邻居都遭受超痛苦在这种痛苦当中困难中我们一定要去支持他们，我们也知道他们需要什么，我们要相互客气相互忍让我们要有热情我们要有怀有我们的这个爱心，让我们安心度过这个冬天，这个安全的度过这个冬天。那么卫生厅长又要来总结一下这个过去的24小时死亡8例卫生局的分布情况。
Thank you very much, Dr. Henry, and thank you for your continuing work and service on this issue. It is an extraordinary thing to witness every day. I wanted to pass on my condolences that of the government, I think that of everyone, the province, the 8 people who passed away from COVID-19 in British Columbia in the last day.
表示诚挚的哀悼。
We say this, but I think it's important to reflect in these times
我
when
们
we
也知道
are
大家为了
extending
拉低疫情
health
所造
measures
成
to
了很
deal
大的困难
that in
遇到了
effect
很大的
stop
困
some
难
of our ways of coming together as a
因为
community.
大家都
And for
这个
those
社区里
8
边
families,
不
for
能
those
聚
8
集
communities of caregivers, for
现
those
在
8
这个8个
communities,
家
for those
庭已经
communities
又
of friends
失
of the
去
people
了
who
亲
passed
人
away. It means that
这个社
not
区
only
的损
has
失
this
家庭
occurred
的
in these
损
very
失
difficult
朋友之
circumstances,
间的损
but
失
that people are unable to come together and grieve
因
in the way
为
that
大家
we
又
would
不
want to
能
grieve, that we
聚
would
集
expect
起
to
来再
grieve.
去哀悼
So we want
所
to
以
hold
我也
all
是
of those
你们的
families,
痛
all
苦
of those
你们
people
的
in their
损失
memories
我们
in
都
our
能感
thoughts
觉到
today.
我们都
I
时刻的
am,
想念这些
note
你们的痛苦
that we have 761 new cases of
那
COVID-19
么昨
today.
天已经
That there are
761个新增案例
6,349
那么现
active
在呢
cases,
有
which is
6349
about the
个
same as yesterday,
这个
and slightly less than
活跃案
in
例
previous days,
那
but
么比
still
前几天
very
少了
high objectively.
前几天
372 people in hospital, less
那
than
么
yesterday,
372 个
but
是
generally
住
the
院
highest
的
levels we've
那么
seen.
现在还是一般而言还比较
74 in
高
critical care.
那么其中
That
74
we've
个在
now
重症
provided
监护
41,064 doses of
那么现在呢
vaccine.
有
And what all
41064
of
个
this
人接受了疫苗
demonstrates is the extraordinary work, the remarkable work, the generous work of people in our
很
healthcare
多人呢
system.
也
And I
是
salute
付
them
出了
today
辛
and
勤的
all
工
of the
作
people
用自己慷
supporting
慨的
those
心情
that are going
为社
through
区为大家做出贡献
are dealing with COVID-19 in whatever way they're dealing with it. Dr. Henry,
那么也
with an
感谢
extension
这
of
个
the orders to
亨利
February
医生
the 5th. And this is clearly a necessary thing given what we're seeing here and given what we're seeing elsewhere. We do know that the impact of COVID-19 now and over the course of the pandemic has been especially felt in long-term care.
那么他也是说到了这个疫情对长期护理院的冲击太大，大家都看到了。
apologize to people in the media for that delay.
那么大家可能也看到了我们省政府
About
的决定。
outbreaks in long-term care and assisted living in BC. I think there are 51 current outbreaks, and so
那
what
么现在在这
people
个
will be
协
able to
助性
see
的
by care
治疗
home is
住
the
住
size
所
of the
以及
outbreak, the
养老
number
院，
of
还有51个
residents,
在
the
爆
number
发
of
状态
staff
中
who have
那
tested
么还有
positive
一
for
些人居
COVID-19
民
and the number of
等
people
等这
who
个
passed
职
away in
员
that care home, and
和特
every
别是
one
那
of
些
those
这
people
个
and every
协
one
助
of
性的这
those
些
families going
诊
through
疗所
outbreaks.
等等
And this
还
is
有人死
something
亡等
that
等。
as an individual I know about and I know what it means, but also in every case from
761个
Valley,
各位观众，这个过去24小时有761个，就像 Dr. Bonnie 医生说了，这2天又有上升的趋势了。这个一定的，就是圣诞节，圣诞节现在离开圣诞节正好快2个星期了，其实就是这个时间点，我一点都不吃惊。
every Thursday, so we'll be updating the facility information every Thursday.
那么现在每个礼拜四呢，也会给大家更新这个我们的机构的这个信息的问题，信息的这个机构的信息包括了他们的这个长期护理院的情况。
All the measures have been taken.
所有的措施都已经落实到位了，大家都做了。
Whether it's currently at Little Mountain or any other community in BC or any other care home in BC is really that concerned about how they're doing in Ontario or Quebec. They're worried about their family, their loved one, their community, their care home, and so am I. And so we've provided this information. It is a subject of continued focus and concern to limit the size of those outbreaks, and also it has been the focus of our effort to provide vaccination to those care homes, and you're seeing that and you're seeing reports of that, and that is the focus. The overwhelming majority of vaccinations that have occurred in BC so far have been for people in long-term care and for people who work in long-term care.
或者是那些职员身上。
is available, and we will have a few more minutes for questions as well later today in order to ensure that people have the opportunity to ask the questions they feel they need to ask. Equally, I wanted to just announce briefly, and this is a technical question, but an important one, and one people have been asking about, is that there is an updated visitation policy for long-term care.
那么现在又是说到了长期护理院的看访的这个政策问题。那么现在都一样的，不会变，因为上次说过了，11月中旬、11月上旬和中旬连续发布了2个禁令，一直到延长到12月份，一直到延长到1月7号，现在一直到延长到2月5号，这个请大家再注意一下。那么这里边包括了这个私人田径、私人聚会，以及这个特殊运动的开展，以及长期护理院的探访政策都不会变，都在延长到2月15号。
Families and residents, but also from workers and providers themselves. So this provides consistency, and it also provides a clear pathway when a family or a person disagrees with a decision not to allow an essential visit. So I encourage people to review that.
所以也请大家能够看我们的这个
With respect to our surgical renewal commitment, we talked about a lot about it yesterday, so I'm just going to keep that very simple and say that health authorities resumed non-urgent surgeries on May 18th.
那么又说到了这个长期护理院的这个开刀的这个择期开刀的恢复情况，这个也是他还怎么回事
？Unscheduled or emergency surgeries. We've updated the numbers from December 14th to 20th, just the pre-Christmas period. Health authorities now verified their data, and the total number of surgeries that was completed in that week is 7,247, which is 140 more surgeries in a pandemic than the same week last year. From December 21st to January 3rd, which is a broader period, we're reporting we completed 5,723 surgeries. That is 239 more surgeries than in the same 2-week period last year, again, when there was no pandemic. Very briefly, just to say that we've hired additional people in contact tracing. The number of people hired is now 1,313. That's 16 more than last week and significantly more than our target, which was 1,224. And so all of those things are, and so as we provided a lot of information today, just want to say finally, and this is reflected in the situation in long-term care in our province. It's why all of the policies have been put in place, from single site to resources directly to providers to increases in the support for staffing, the people that have been hired to support that, to the infection control measures, all of those things. And still, and yet, we are saddened by the enormity of loss of our seniors and elders. It is, I think, a feeling of sadness and of loss that should stay with us for some time. I know it does for me and for us every single day, and it will stay with us for a long time.
那么不是所有的观众从一开始就收看我们的直播，在过去的24小时里边新增了761个，那么总数现在 BC 省到了56,015个，其中新增的24小时里边，沿岸卫生局新增了94个，飞沙卫生局新增了484个，岛上卫生局新增了23个，内陆卫生局新增了96个，北部卫生局新增了64个。那么目前为止记录在案的这个活跃案子是6349个，住院呢是372个，其中74个在重症监护，这个370多个一直维持了，我看了看一直维持，从349 12月上旬到了340几，到了30几，370几是从12月29号开始一直到370几，370几。那么1月4号还351个。那1月17号就是372个，那重症监护呢是相对少了，原来是住院人数少，12月17号住院是388个，98个在重症监护，那个12月上旬的时候还83个，77个在重症监护，那么目前来讲，貌似重症监护人少了这个住院人数
Aujourd'hui, nous annonçons 761 nouveaux cas qui ont testé positifs pour COVID-19. pour un total de 56
都是370多，其实
en
370多，就是1月4号一下子下来20个，350几个。这个所以今天又一下子上去21个了，所以变成372个了。我再看看11月份的啊，11月的话，哇，11月中旬才100多个住院，到了10月19号就200多个住院了。这个是住院人数是直线上升。
dont 74 en soins intensifs. Merci beaucoup. Thank you very much.
今天这个可能是创纪录了，761个。
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. I would also ask that you please take your phones off mute. You're not audible until your name is called. First question today is from Ashley Wadwani, Black Press.
Hi, Dr. Henry and Minister Dix. With vaccinations now underway, I was hoping you could speak to how community or herd immunity works. Have we determined a certain threshold or percentage of British Columbians to determine what this kind of immunity
那么这位记者想问的就是群体的这个社区的群体的免疫，因为你是到%几就可以不打了，因为现在疫苗你们的计划啊，他是说你是国际上是什么水平就不要再打了，就是你们的计划达到。这个问题问得很好。
To start with the last question, BC's restart plan was for last year. We're now into a completely different phase of the pandemic. So we are looking at the end of the pandemic and what will that mean? But part of that, of course, hinges on what I prefer to call community immunity or herd immunity. So with this virus, the level of infectiousness of this virus, and we use the reproductive numbers, an estimate of that, an average estimate.
能够这个不能让病毒能够复制或者是传播，那么这个
60 to 75%
那么模型告诉我们是人口到了60%到75%的时候，就是60%到75%的人体有免疫了，那么这样的话，他说病毒就找不到人去传播了，那么这个病毒就会慢慢。那么现在我们看是早着呢。
And people are immune because they've been immunized or because they have had natural infection. And we're a long way from that anywhere in the world. And we are not in a place where we're even striving for that yet because of the limited amount of vaccine that we have in this first few months of quarter 1 of 2021. The amount of vaccine that we are expecting, and we still don't have a guarantee yet of that, but in Canada and in BC, we have a limited amount of the Pfizer and the Moderna vaccines that will be coming in the coming months. And that's why we have focused. It's not enough to achieve herd immunity. It's about a little under 10% of our population. So our focus in this phase in quarter 1 is using those vaccines to protect those people who are most at risk of getting ill and dying from COVID-19 and making sure that we're protecting our healthcare system so that it doesn't get overwhelmed and we're able to provide health services for everybody else. So that's the primary focus for these weeks. That's why we're focusing on long-term care, because we know that's where this virus is most devastating. So we started with people who work in long-term care because we weren't at first able to move the limited amounts of Pfizer vaccine we received. But now we are moving out the Pfizer vaccine after the company has given very specific directions of how to do that to make sure that this product remains stable and works. So we have been in this past week very actively going out to all long-term care homes in the province. We're not at 100% yet, but we're getting there. That is our absolute focus for the next few weeks, as well as key healthcare workers who work in COVID wards, ICUs, emergency departments, paramedics who take people back and forth from long-term care, people who go into long-term care to help manage outbreaks. So that's been our focus, and as you know, of course, some of our most at-risk remote and rural communities. As we get more vaccine, and right now, on the horizon are a couple of vaccines. There's the AstraZeneca vaccine, the Johnson Johnson vaccine. But they are not yet approved for use, and we do not yet have any indication that we would get them before March. So the contracts, from what we are told from the federal government, the contracts for both of those products are for quarter 2 of 2021, so that's April and beyond. Once we get those vaccines online, they are ones that were much more, they're much more usable in terms of they are fridge stable, and so that's our usual immunization programs. So we can start aiming towards that community immunity once we start having enough vaccine and enough types of vaccines that we can get it out to pharmacists and physicians' offices and workplaces and others. And so those are the things that we are working on and that we'll be coming up with and providing you with details on in the coming weeks. Oh, excuse me.
今天的亨利医生好像喉咙有点干燥啊，一个是拼命喝水，第二个是干咳。刚才
there's a difference of scientific opinion about whether the second dose should be extended past the date set in the trials. I think that's 21 days for Pfizer, 28 for Moderna. I know BC said they could extend that up to 35 days. I'm interested in just knowing in some more detail about the thinking around this decision, how the risks.
那么你们这么做的一个决定，给人带来风险有多大？
So I think there's a couple of things here, and it is something that us in people who work with vaccinations, immunizations, are very familiar with this type of dosing and programs, and there are minimum intervals between doses, and then there are very rarely maximum intervals before you have to restart a series, as it were. So this is a 2-dose series, and we are committed, as we have said repeatedly, to everybody getting their second dose. What we do know, with the limited supply that we have, and looking at the data that has come out of the clinical trials, both for Pfizer and Moderna, and we've looked at that data in some detail in our clinical and immunization experts at the BC CDC, and we have a BC Immunization Committee who looks at that, as well as the National Advisory Committee on Immunization who looks at those clinical trials and the raw data from those trials in detail. And what that data shows for both Moderna and Pfizer is that 2 weeks after the first dose, the protection is very, very high in the 85 to 90% range. And then the second dose, within a week of the second dose, that goes up to the 95%. So it tells us that once your body has developed an immune response, you have very high protective levels. And these are amazing protective levels. When we look at the levels we get from influenza immunization, for example, they're around 70%, and we would have been happy with that. But to have these very high protection levels very early on with these vaccines, it really proves to us that these new platforms for delivering an immune response to the body work and work well. And so what we have looked at also from the trials is the time periods that people were given the vaccine in the trials. And for the Pfizer and Moderna, for the Pfizer in particular, the outside edge was, I think, 48 days, and there was no diminution in protection in that period of time. In the Moderna, it was very similar. It was actually a little bit longer. I think it was up to somewhere in the 50 or 60 days after the first dose. So the manufacturer, when they provide the information to Health Canada and the details, they have a recommended dose interval, and the recommended dose interval is 21 to 28 days for Pfizer. So Pfizer had initially said 21 days, Moderna was 28 days was the recommended ideal time frame, but they've adjusted so that it can be aligned, recognizing the complexity of systems make it challenging. So both of them said somewhere around 28 days. Moderna, it was actually up to 35 days. Anyway, there is a range that is safe for using these vaccines, and that has been upheld by the UK vaccine expert committee as well as NACI. So there is a minimum interval. If you give it too soon, it doesn't have that boosting effect that you want to have. The other thing that we know from immunology is that if you delay a dose for most vaccines, that gives you a stronger and longer lasting effect. We don't know that. There is no data for that for these vaccines because the studies were done to try and finish them as soon as possible. So they had a minimum interval between the 2 doses being given. But there's a very real probability that there will be confer a benefit from slight delays in the second dose. That is under investigation both here in the monitoring we're doing in the UK and elsewhere. So the bottom line is, what we have done is we have an emergency operations center structure that Dr. Ross Brown and myself are part of, are running. And we have a process where all of the scientific information is pulled together from our immunization committee, and then a recommendation is made, and we look at the operational issues. So as you know, the vaccine that we're receiving through the federal government is back-end loaded. We are getting small amounts of doses in the first few weeks, and then more as we go into February and March. So that meant that we would have to keep doses in fridges if we went with a strict 21 days. And there's the balance of evidence that we have on being able to protect people, the very high short-term protection that we get from the first dose after 2 weeks, and the fact that we were getting more vaccine to be able to give second doses within a reasonable time frame that was in the trials. So that's kind of a long-winded way of saying we did an ethical review, we looked at the data, we looked at the modeling of how many people we could best protect, and we looked at the operational issues of how much vaccine we're expecting to get at what time. And we made the decision that we would look at 35 days as being the standard. And if we get vaccine as expected, people who received their doses in December and January will receive dose 2 around 35 days from their initial shot. And we absolutely, the science bears out that this is a reasonable approach that maximizes our ability to protect more people during this, the most infectious and period where we have the highest rates of transmission. So it is a balancing, but we absolutely did an ethical review, and that decision was made with all of those pieces of information in mind.
这些问题科学和道德这个很重要的问题不能说是不道德不讲人道不是的。
Will it be extended to all vaccines? You mentioned that there are obviously others that are in trial right now.
It will really depend. It will be for the first few months, given what we know about vaccine supply. If we get a lot more supply, then we absolutely will try and do it on the optimal schedule. So we will also be very much evaluating this as we go. If there's any signal that people are not getting the protection they need because we're delaying by a week their second dose, then we will change that. So that's really important that we do monitor these things. As well, around the world, we're monitoring, how long does this protection last? And we don't know the answers to those things yet. So in some places, the UK is looking at the level of protection people are getting out to 12 weeks. We know that some people who don't come back for their second dose, and we can tell if they ended up with infection. So these are ways of helping us understand. We also will be looking at whether one dose is sufficient, and that's something that the company is looking at. We are, as I said, committed to doing a 2-dose program here in BC, and the minimal delay that we're talking about for the first couple of months is well within the safety parameters and effectiveness parameters. So it'll depend on what we learn about these vaccines in the coming months. It will also depend on the new vaccines that we have. Some of them are single-dose vaccines programs, and the Janssen or the Johnson one in particular is their clinical trials has 3 arms. One of the arms is a single dose. So it'll be great if that worked. And there's some really good data that the UK has from AstraZeneca that showed that the people who got the doses later, so missed for operational reasons, didn't get their second dose until 8, 9, or 10 weeks, actually had better protection overall. So that's intriguing, and we need to learn more about that.
Next question is from Prabhat Sohal, Red FM.
这个也是今天学到了，英国有些人没打第二针，忘了打第二针，反而你看第10周到12周的时候反而更好，保护率更高。
Nearly 90% of the backlog surgery. So my question is related to the surgical renewal strategy. I want to know that since this has been achieved through hiring more staff and increasing operation hours, what is going to be the long-term effect of this strategy? And do you think that this is sustainable and will continue towards the end of the pandemic or after the pandemic? And lastly, do you think that it would eventually lead to reducing the overall wait times in surgery? I could have your opinion and view on that.
Yes. First of all, this is part of a surgical strategy that's been in place for a couple of years. We very significantly increased the hip and knee replacement surgeries. I think we went from a baseline of 14,250 in 2016-17 up to 2019-20 of approximately 19,000, which is a very significant increase. Increased number of dental surgeries, which is a priority, particularly for adults and children with developmental disabilities. And we dramatically increased, the most significant increases in number of surgeries that had taken place for many, many years in that time, including the 2019-20 year and 2018-2019 year, which were excellent. And so part of the way we did that was applying more resources, as you say, adding staff, adding operating room time. In addition to that, in addition to those two important factors, we increased and improved procedures in our system to make our system more efficient. And I think our surgeons, our nurses, but also our healthcare workers, those involved in our health sciences professionals deserve a lot of credit for that, because a lot of what makes that successful happens before and after the surgery. The surgical renewal plan that's been in place that we talked about in detail yesterday, and I recommend looking at those reports, shows our commitment to addressing and to making up for the surgeries that were lost when non-urgent scheduled surgeries, sometimes called elective surgeries, were canceled in March of 2020. It's been an extraordinary success so far, and it's our expectation and intention to add to our increase in OR time. That will require, having more staff. But I believe that if we continue to follow this path, working with our healthcare professionals, our healthcare workers, we're going to continue to have success. Michael Marchbank, who I asked to lead this effort, I think has done an extraordinary job, but he didn't do it alone. It's everyone who's been involved in that. The idea that in a pandemic, in a second wave of a pandemic, that we did significantly more surgeries over the Christmas break than we did last year, and the week before Christmas, and the week before that is a real achievement of our public health care system, and it demonstrates our commitment to reducing those wait times, a commitment that existed before the pandemic, but has been given particular emphasis given the cancellation of non-urgent elective surgeries in the spring.
Prabhat, do you have a follow-up?
Yes, I just wanted a clarification that the current rate that you're going at, this you believe will continue. Like you said, you have before the pandemic also you had this strategy. So you intend to keep these levels, and considering the pressure on the health system right now, this will be continued.
Well, this is an important priority. We know, and you see it whenever you see individual stories. You sometimes talk about the whole numbers, but the individual stories of people who wait for surgery and wait for health care are important and often moving. So yes, it's our intention to proceed with the surgical renewal plan, which sees 2021-22 as a significant increase over 2020-21 to reduce the backlog that was created by the delay in surgeries in the spring, and then continue to do that work. And that's our expectation, and continue, which means increasing operating room time, hiring the staff that we need, increasing the efficiency of the system, engaging with patients in a better way. And the very fact of calling and engaging with patients over the past months, I think, has been extremely beneficial both to patients and to our ability to provide the services. So I think the success of the surgical renewal plan so far reflects well on everybody involved, and demonstrates again why the public healthcare system, working in this case, and including contracted providers, but the public healthcare system provides the best responses to things like surgical backlogs.
Binder Sajjan, CTV.
Hi there. Just wondering, with regards to the restrictions, will you be having conversations with churches, movie theaters, restaurants, and others who are
他说这个禁令的延长，你有没有跟教会啊、餐饮业啊等等他们讨论过啊？因为你们现在不断的在延长这个禁令，到什么时候才能下来？
And you know, it is. You're absolutely right. It does differentially affect certain aspects of our life. I mean, part of this is around all of us and our social gatherings in our home and staying with our households. And yes, we are engaged and will continue to engage with faith and spiritual leaders. And I've had a conversation with Dr. Rabbi Dong, and we are looking at how we can work together to support faith communities over the next few weeks and how we can best find ways to safely come back together. But right now, it's about risk of transmission in our communities, and we need to focus on those essential work on our healthcare system, on children being in schools, and everything else. We need to continue to take those precautions and not waver right now when we have light in sight, when we have immunization that's coming, not as fast as we want, but it's coming. And we have to remember that we know how to stop transmission in our communities, and we can do it. We have clusters in a number of communities where the rates have been going up, and people are frustrated, and this is our time to be calm with each other. We have to remember that we can stop this virus, and we need to do everything to keep our rates down now so that we don't see it rapidly taking off at this time when we have so much potential with our immunization program as soon as we can get enough vaccine.
我们现在还没有疫苗啊，所以这个只有到疫苗来了，我们才能真正安全。
Dr. Henry, about Little Mountain Place, and wondering what else you've learned about the outbreak and how the virus spread. We are hearing reports that family members are being told that perhaps staff were coming in, pushing through some COVID-like symptoms because they were worried about staffing shortages. Just wondering if you can provide some insight, some more insight today about this deadly outbreak in our long-term care homes.
这个深度的这个分析，也就是说有一个 Little Mountain 的这个长期护理院，由于职员也缺少那么那边死了那么多人，有一些这个深层次的原因，你能不能给我们分析一下？
Me. I know that my colleagues, the care workers I talk to, the nurses I talk to, the physicians who work in this area, everybody, we have a culture of presenteeism in healthcare, and especially in care homes where we know that the people who work there are there to provide the best support they can to the residents. They care a lot. They become like family in many of our care homes, and nobody intentionally wants to bring it in. But we have seen that in many cases where people are in denial that that I'm sick, or that this could be really this, or that it's affecting me. And that is why we have, particularly in outbreaks, we have regular testing of healthcare workers and staff and residents at periodic times, several times a week during these outbreaks to pick up people when they may not recognize it. And also we need to really pay attention. It's hard when it's your home, when you're caring for somebody in what is their home, to make sure that you're using your PPE all the time. And that's the other part that we need, that we work on with when there's an outbreak, making sure that people are trained again, that they remember to clean their hands, that they remember to put their mask on and off, that they remember to wear the PPE that they need for the task that they're doing with individuals. And it's very, very challenging.
Next question is from Richard Zussman, Global News.
Dr. Henry, I'd like to ask you about the top health educator at UBC School of Population and Public Health. He's now apologized for traveling to Hawaii. Some students at the school are calling for his resignation. What are your thoughts, and should people in positions of this regard, especially in public health, be setting a better example?
You know, I think we have seen that many people make decisions that they may not recognize the implications of. And it's, I'm not going to comment on whether it was right or wrong or good or bad. I think we all need to recognize that this global pandemic is making us rethink things that we may have taken for granted. And right now, more than ever, we need to stay put and not travel. And it really is, the UK variant and the angst that causes, the fact that we're seeing changes in other in the virus in other parts of the world, it brings home that risk that we have here and how interconnected we are. And I will just say that I know many of us spent our time close to home this holiday season, and I'm very grateful for those people who did that.
And, I think especially this week, reflecting on what we've seen in the United States and elsewhere, I think we need to remind ourselves that we're Canadians. We live in a world. And so when we travel to places,
那么他也是说到了，大家可以看到美国这个礼拜的情况啊，我们也是很自豪，我们是在加拿大，我们是自己很清楚，我们的命令，我们的限制在哪里，大家如何不要去这个旅游，避免旅游啊。我们加拿大人不是美国人，大家都看到了啊，我们的很多人都自觉遵守，我不是这个就是基础工作的人啊，那么就不怎么走来走去。
I think we just simply need
所以我认为我们不要避免去旅行啊，这个就是告诉大家，不要避免这个，就是避免那种非必要的这个旅行。这个是我们加拿大人以及我们 BC 人，这个也是责任，也是我们一定要搞清楚。就算如果我们从外面回来，你要对社区负责，对家里边负责，所以你还是。
certain work that is so essential that they may need to have that, but in a general sense, without exception, and that we consider that when we're traveling to other places as well, particularly on vacation, what our responsibilities are when we travel to the communities that we travel to.
Richard, do you have a follow-up?
Many British Columbians have been living under these restrictions now around a ban on social gatherings since the end of November, some since sort of mid to early December. We know there are rule breakers. The messaging has been very consistent and similar from you. So are you not just punishing those
他也说到了 BC 省绝大部分人从11月你发布的禁令以后，一直到现在后遵守，但是还是有一些人在破坏规则，不遵守这些规矩。那你们有没有考虑到给他们这些不遵守规矩的人做些惩罚
I think I tried to address that a little bit. Today
他说我再强调一下在我的刚才说的话里面再讲我们觉得真的是有点沮丧
and say, nobody's following the rules. But I think what we know in BC is that the vast majority of us are doing our best.
绝大部分人都是遵守我们的行为规范。我只能说很多组人在遵守这个行为规范遵守这个卫生命令
really matter. And most of us would look back and say, oh, well, maybe I shouldn't have done that. And I don't think any of us have ever gone through something like this where we haven't wavered now and then. Which doesn't mean it's okay. It just means it's hard, and we have to have compassion. We have to understand that not everybody thinks the right way, and they make tragic mistakes. And I try, and we can all do our best by trying to, in a calm way, support each other to do the right thing, making the right thing the easiest thing, making the right thing the socially appropriate thing to do, whether that's not inviting your family family over, or me giving you permission to say no, I can't come over. No, I can't go with you. No, I can't do this right now. And we need our leaders and our families and our communities to support each other to do that. We can't dwell on the people who've made mistakes. What we need to do is recognize that we all have it in us now to do those little acts of heroism every day. And along with that, you need to find joy every day. This is a long road. And we've been, I did my triathlon analogy, which people didn't like, but that's okay. We're in the marathon, but we don't know when it's going to end yet. We have to pace ourselves. And the only way we're going to get through this is by being kind to each other, because kindness is what helps us get through these days.
We have time for one more question for everyone listening. Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Tanya Fletcher, CBC.
Dr. Henry, this question is also connected to administering the second dose of the vaccine.
那么这个也是问的第二针的问题，第二针疫苗的问题。
To receiving that second dose 21 to 28 days after getting the first dose, and they now say they feel as though they've been misled. Should they be able to receive that the second dose that they had agreed to in that time frame before the policy changed? Should they have that option?
So the policy was in play from the beginning, and what people consented to was a 2-dose series with the expectation that, or the recommendation is that it would be around 21 to 28 days. And we have this with all of our immunization programs, that there's sometimes operational reasons where things have to be moved from one, slightly. And this is well within the safety parameters that we know from the data. I didn't mention, but the WHO has come out and said within 42 days is a recommendation from WHO looking at the same data. So this is not about misleading people. It's about consenting to a 2-dose series, which we are committed to, and the operational issues of making sure that we can maximize the protection for those who need it, and make sure we can give that second dose in a safe time frame, given the operational considerations and the amount of vaccine that we're getting.
也是可行方案，这样的话呢，有更多的人来打，让我们这个计划就可以更可行。
We currently don't see teachers and firefighters listed on BC's vaccine priority groups. Both groups have been lobbying to be included higher up in the rollout plan. So is the province considering prioritizing those groups?
So right now, our priorities, as you've seen, deal with the vaccine that we think we're going to get in quarter one, and the people that we can immunize with that vaccine that we're scheduled to get. And that is the focus of, that we've seen, which is long-term care, critical healthcare workers, key at-risk isolated and remote communities, particularly First Nations communities, and people in the community over age 80. So those are what we're focusing on from now to March. After March, we are expecting to get more vaccines, different vaccines, and more volume of vaccines. And we have not yet put out our strategy for the second quarter and into the summer and fall of 2021. There's discussions going on at the National Advisory Committee on Immunizations around practicalities and how we do this. And believe me, it's not just firefighters, it's veterinarians, it's poultry workers, it's there's a whole host of people, teachers, of course, childcare. There's many people in our community who need to be immunized and want to be immunized. And our strategy is going to be how can we get as much much vaccine as we are able to get into as many arms as we can. And with more details of that will follow. Everybody is still included on that list. We are not prioritizing people. We're going to be working through this collectively across the country in the next few weeks, and we'll be giving more details. I do want to say two other things, as I've heard some concerns as well expressed from people who are pregnant or breastfeeding, and we do have guidance for people where the recommendation from the National Advisory Committee that we have taken here in BC is that it's an individual choice based on your own risk assessment. So a pregnant healthcare worker or a breastfeeding healthcare worker who works in an ICU may choose to take the vaccine over the risk that they may have from COVID. And we have some detailed information on the BC CDC website for clinicians, because that is a discussion that a person has to have with their physician about their own personal risk benefits. And the same goes for people who are immune-compromised. As we know, the two vaccines that we have right now are not recommended for people who have immune-compromising conditions, and those are very specific. And so it is not, it's not everybody, it's some autoimmune disorders, but it's mostly focused on, and some people who are on immune suppressing medications at very high levels, and it's also for people who are taking some types of cancer treatment, for example. Right now, as well, in BC, these vaccines are not recommended, but again, it's because they have not been studied, so we don't know if people will mount an immune response. And again, it comes down to a personal risk assessment. So people who are undergoing cancer therapy need to talk to their clinician about the risk benefit of receiving the vaccine. So those are all things that are really important. We have not forgotten people who are immune-compromised, and we will be, as the evidence and the data comes about different vaccines and new vaccines, and we learn more about the two we have, and we'll be updating those as well.
疫苗以及在这些人群身体上的这个作用和副作用等等啊。那么现在卫生厅长就做这个法语了。那么我把昨天24小时的数据再给大家重复一下。在昨天到今天24小时里边新增了761例，那么 BC 省总数就到了56015人，其中延安卫生局新增了94例，飞沙卫生局新增了484例，岛上卫生局新增了23例，内陆卫生局新增了96例，以及北部卫生局新增了64例。目前为止active 的案子是6349例，这个12月份的时候最高的时候1万多例啊 active case。那么目前呢372人住院，其中74个人在做重症监护。那么在过去24小时里边，很遗憾新增了8例死亡。那么 BC 省与新冠病毒有关的死亡现在是累计总数到了970个。到昨天为止，今天还没有。目前为止 ，BC 省到昨天为止是41064个人接受过了这个第一针的疫苗施打，目前为止都是第一针啊。那么以后可能给大家公布的时候，可能会说第一针打了多少人，第二针打了多少人啊。那么 BC 省目前只能是打第一针。今天的伯恩医生呢，也是给大家总结一下，解释了一下为什么 BC 省是35天。那么厂家建议是21天也有，28天，辉瑞就是21到28，摩德纳是28到35，那么 BC 省呢是35。那么他也举了一个英国的例子，也就能这个忘了打了或者怎么样科学发觉呢，到了打了第一针之后的第8周到12周呢，人体的免疫水平是最高的啊，这个也是他们做决策的他们做决策的依据。当然他说了，这个科学决策以及这个怎么说人道以及道德方面都要考虑，所以这不存在误导，也不存在特意延缓给人家打这个第二针的 这个决定。好了，各位观众，那么今天呢，这个 BC 省的新冠疫情的新闻简报就给大家直播到这儿。下星期一，也就是1月11号，我们再回来，欢迎大家继续关注我们。感谢大家的收看，今天的直播就到这儿，我们下期